So my name is JJ Valdez. Some people know me as JJtheRT. I'm the Director of Clinical Education at Victoria College. So a little bit about how I got into RT education. About 8 years ago, I had the opportunity to be the educator at the hospital that I was working at. So that meant onboarding the staff. That meant educating the staff whenever they were going into the ICU. I didn't realize that it was going to be educating in other disciplines as well. Once I kind of realized that I had a knack for this, there was a way that I could relate to the older generations and I could relate to the younger generations. So during that time, I started to pursue my bachelor's degree. And that I found even more that when we would do group projects, that I was doing a lot of teaching and it just felt really natural. I continued to pursue my master's, and I knew that with that, I ultimately wanted to get to a place where I was impacting students. I've been at Victoria College for 2 years, starting my third year, and we've seen two cohorts go through already, bringing in the third one this year. And the first 2 years were a very steep learning curve, but I feel a whole lot more comfortable now, and I feel like I can start to express my creativity a little bit more. But ultimately, I knew that I wanted to have a reach that was beyond just myself. If I could train future respiratory therapists to kind of think differently or act differently, I knew that my impact would be a lot wider than me being able to take care of patients at the bedside just by myself. I think some of the tools that I use are life experiences. There's so many opportunities for people to relate to situations through our learned experiences. And one of my favorite leadership coaches is John Maxwell. He says, evaluated experience is the best teacher. So why not use our own evaluated experiences to teach along the way? And developing the ability to tell a story, I think, helps make it really, really relatable as well. So, evaluated experience and then being able to tell a story would be a couple of the tools that I try to utilize. Yeah. So, the thing that I love the most is seeing the light bulbs go on, seeing that aha moment when you may have said something two, three, five, 17 times. But then when they see it and they can tangibly apply it to a patient, and it's like, I get it now. Like I can see it. Those are the best moments as a RT educator, just seeing the light bulb moments. So one specific time that I can think of is it was before my time as an RT educator. I was the educator in the hospital, and so many times I would have them do things multiple times. Go talk to that doctor and ask him what this disease process is. How does it work? Specifically, there was one um, of our interns who got into respiratory because her mom had heart issues and she needed a cabbage, so a bypass of her coronary arteries. And she was so scared because she did not know what that was and the impact and how serious it was. But whenever she got to go into and observe her first cabbage procedure as an intern, it was that aha moment, that light bulb moment. It kind of brought her full circle as to why she wanted to be a respiratory therapist. Yeah, if you're looking to expand your network and your social network and your ability to collaborate, um, show up to the conferences. Go to your state conference. Go to the national conferences. I even jump onto different podcasts that talk about respiratory therapy. One of the first times that I ever heard the name Brady Scott was before he was actually Dr. Brady Scott, and it was him having a conversation with a group of guys out of California when he was there for a state conference, and the things that he was saying like lit my fire. It was one of the things that I felt, and I finally heard somebody saying the same things that I had felt. A lot of the folks that we have in the profession right now, they're very, very personable. You can reach out to them on LinkedIn, you can reach out to them on Instagram or Facebook or any of the different platforms, and they're willing to have a conversation with you. I think collaboration is a huge tool that we can use to help ultimately, ultimately it helps bring better care to our patients. Earlier this morning, I was able to talk with some of our students that were at a clinical site and having a conversation with the clinical instructor that was there with them. And we were discussing some of the conversations that we've been having with our students here recently. It led to a conversation of what are some practices that we can use that will help the success rate of extubating a patient from mechanical ventilation or liberating them from the ventilator. And one of the practices that we had at one of the facilities that I worked at, we would extubate patients to a certain device. And that led to a reduction of reintubating patients by 50%. Having that conversation with that instructor in that moment, there was a nurse that was listening, and she could see the impact of, hey, if this patient that we're looking at is kind of iffy on they're going to be a successful liberation from the ventilator, now they at least have the idea that there's a different path that we can take, and it could lead to better outcomes for this patient. So I am a huge advocate for collaboration, for coming together. One of my good friends and I, you guys know him as respiratory coach. He's my good friend Joe Lewis. I've called him my spirit animal. We used to have a conversation regularly on Instagram Live, and we called it the bridge. And it was an opportunity for us to bridge different levels and calibers of therapists. Are you a student, that's working on your associate's degree? Are you a therapist that's only got 1 year experience, or do you have 20 years experience? And through those Instagram lives, we were able to kind of connect the dots between these different, levels of respiratory therapists. And it was amazing. So a support network is so important. You've got to have somebody that you lean on, somebody that you can just bounce ideas off of, somebody that you can simply just say, man, this is hard. And what am I going to do? For me, that's whenever I get in contact with folks at these state conferences and these national conferences. There's a number of people: Dr. Brady Scott, Karsten Roberts, Emily Lamarina, Matt Pavlechko. He is one of my good friends. We actually have scheduled calls now. Cece Oldmixon, she kind of groomed me into a position to where I am now, and we have regular conversations. Since she's my program director, we get to talk and just have these moments of, I'm trying all the things that I know to do, and it's not clicking for them. And she's been there to tell me, like, just keep telling them, keep repeating it, try it a different way. Maybe if you do it this way, it'll make sense for them. And I've been that same person for her as well. There's a plethora of respiratory therapists that you can lean on that can help you when you are feeling like, I don't know if I can do this right now. It didn't happen overnight. It was one of those things where I slowly got integrated into different positions. So one of those positions was I was willing to be a preceptor. I was willing to train some of our new therapists on night shift, kind of the ways of the facility. I knew the policies and procedures really well. And that then led to a chief therapist position. From that chief therapist position, I became the department educator. It was encouraged that we go get our bachelor's so that we could continue the professionalism of being a respiratory therapist. So I got my bachelor's, and there were plenty of opportunities where we would have group projects, and I would kind of explain something so that my peers would understand. Then that kind of catapulted me into like, man, this is really fun. I enjoy doing all of these things. It led me to a point to where I'm now in the classroom 3, 4 times a week, and I get to go to the hospital site at least once a week. So I'm in that really sweet spot where I've got the classroom and I still get to go to the bedside. So I can take the didactic principles that we've been talking about in the classroom, and I can show them and I can bring them to life when we're at the clinical sites. Yeah, so the journey from associates to masters, it's it's really funny. You get to see the growth of JJ throughout it because when I graduated with my associates, I got my CRT really quickly out of school. And I was that therapist that did not want to get his RRT. I was like, I'm good. I got my CRT. I can work. What else do I need? Right? It's going to cost me X, Y, and Z to pay for the exams, and they're only going to give me $1 or 2 raise. That doesn't make sense. The math didn't add at the time. It was really bad RT math at the time. So I ended up at a facility where they said you have to get your RRT within a year. If not, then you're going to have to seek excellence elsewhere. So it was coming up on the 11th month for me to be at that facility. And it was like, okay, I've got 3 weeks to get these things done. And I passed my RRT and my simulation exam within that month. And then at the time, somebody just put a bug in my ear. Like, this is the expectation that you get your bachelor's when you're in leadership positions. And I had moved into the educator's role at the hospital that I was working at. So that bug was dropped. Somebody really close to me was going to get their bachelor's at the same time. And I started, and they never did. But I continued to get all of my classes. I continued to do all the things that I needed to. And there was a 10-year gap between my associates and my bachelor's. And then I took a year off, and then I started my master's in January of 2020. So right before the pandemic broke out, everything was online. So luckily, I was able to complete all my schoolwork online, and ultimately got my master's from Texas State in 2021. So if I were to go back to a point where I realized that I wanted to get into education, it was a moment when I realized that me alone at the bedside was pretty good. Like, I'm not the best, but there were a lot of patients that got really good care while I was at the bedside. There was staff that would reach out to me and say, "Hey, the ventilator is acting really crazy. Can you come take a look and tweak it so that we can get this patient, synchronized with the ventilator?" So I was really good hands-on in taking care of those things. And at one point, this very arrogant boy realized that I wasn't that great. I was good, but I wasn't that great. And in order for me to make that bigger impact, I knew that I had to create and develop those around me to be better than me. I wanted to be like this Dr. House. And then I realized that he was alone all the time. So I had to shift my mindset from being the guy that has all the answers to being the guy who's willing to share any of the knowledge and any of the answers that he has to build up everybody around me so that my reach could go further. Yeah, so anybody that's wanting to get into RT education, I would say do it. It is so rewarding. I'm going to tell you that the first couple of years are going to be very difficult. You're going to feel like you don't know what you're doing. You're going to feel like I was so smart at the bedside. I did all of my things. I knew what I was doing. But all of that was on you. Now you're taking that information that you have and you're sharing it with somebody else, and they may not internalize it the same way you did. If I have any advice, I would say just jump in with both feet and embrace the difficulty because it will grow you. You cannot grow if you're comfortable. So if you're thinking about getting into respiratory therapy or getting into respiratory therapy education, I would say it has been such a rewarding career for me. I had no clue about respiratory therapy. I really thought I wanted to do radiology, but there was a bigger plan than my own. And my path for radiology got closed and it opened up the path for respiratory therapy. And it has led to a beautiful career where I've been able to travel all over this country. I've lived almost an entire year of my life on an island, and it has been amazing. I've met so many beautiful people. I've met so many wonderful therapists and nurses and doctors that have helped me become the clinician and leader that I am today. I would say if you're thinking about getting into respiratory therapy, it is a phenomenal career and it has been very rewarding.